I'm Dr. Edgardo Rivera. I'm a medical oncologist, and I'm also a medical director for the Nugent Cancer Center in Kingman, Arizona. And today I actually have the pleasure to talk to all of you about breast cancer screening and prevention. So breast cancer is still the most common cancer and second leading cause of cancer death in women in the United States. We estimate that over 281 new cases of invasive breast cancer will be diagnosed in women in 2021. And over 49,000 of those cases will be also ductal carcinoma in situ. So breast cancer, just like many other cancers, it really takes some time for them to become obvious, to become apparent. So those are things that usually don't happen overnight and can take years before a breast cancer is actually palpable or is even seen by any type of imaging. So I like this slide a lot simply because it's showing you something that we're seeing in the United States and actually worldwide. It has been a decrease in the incidence of invasive breast cancer, but also a decrease in the incidence of ductal carcinoma in situ, especially in women who are over 50. So essentially, we're seeing less and less cases being diagnosed. I also love this slide because we're also seeing a trend that started happening back in the 1990s and has been a decline in the mortality of breast cancer patients. What that means is that more breast cancer patients are surviving the disease, less patients are dying of breast cancer, and this trend has continued to happen over the years. So is breast cancer preventable? Well, like many other cancers, there are multiple factors involved. So same thing with breast cancer is multifactorial. Some of the factors have to do with genetics, our environment, our lifestyle. But there are some things that we can modify. So for example, breastfeeding has been shown to decrease the risk of breast cancer. A sedentary lifestyle has shown to increase the risk of breast cancer. Obesity has also shown to increase the risk of breast cancer over time. Not having children or having them too late in life can increase your risk as well. And like in many other cancers, and like I mentioned earlier, our lifestyle, such as dietary choices, use of alcohol. So there's different factors involved, risk factors involved with the development of breast cancer. Some will increase your risk higher than others. Perhaps the most important ones that I just want to mention briefly is obviously being a female. Breast cancer is something that can happen in males as well. But obviously being a female will bring you a higher risk. If you're older, most breast cancer happen between patients between 50 and 69. But we still see patients who are younger than 50 that do develop the disease. If you already have a history of breast cancer in the past, and you still have the contralateral breast, obviously there will be an increased risk over time. If you've been diagnosed with some sort of pre-malignant or predisposing condition that will put you at high risk, that will also increase your risk over time. If you do have a strong family history of breast cancer, it also puts you at a very high risk category. And I'm not going to go through all these risk factors that you see on this table, but as you can see, there are some that really bring a higher risk than others. People who do have a genetic predisposition will have a very high risk of developing breast cancer over time. There's different genetic mutations that have been discovered nowadays. Probably the two most common ones that you're going to hear about is about BRCA1 and BRCA2. BRCA1 can increase the risk of breast cancer somewhere from 43 to 87%. Up to age 70. It can also increase the risk of a contralateral breast cancer of 40 to 64%. And there are also an association not only with breast cancer, but also with an increased risk of ovarian cancer. With BRCA1, that risk is about 16 to 46%. We also have BRCA2. Again, there's increased risk of breast cancer over your lifetime up to age 70. An increased risk of contralateral breast cancer, and also an increased risk of ovarian cancer over time, somewhere from 11 to 27%. BRCA2 is associated with the development of other malignancies, specifically male breast cancer. How do we know who needs to be tested and who should be tested for not only BRCA1, BRCA2, but also other genetic predispositions? Well, there is a criteria that we use, and that will lead us to identify those patients who will require genetic testing. For example, if you do have history of breast cancer in the past of 2 or more breast cancers, or there's a family history, a very strong family history of breast cancer at a very young age. If there's a family history of ovarian cancer, it should also consider be genetically tested. If we already know that you have a family member who has been tested and does have a mutation, obviously you should be, or you should at least consider to be tested. If you are from an at-risk population, in this case, I'm specifically talking about those patients who are Ashkenazi Jewish. They do have a high risk of carrying one of these mutations. If there's a family history of a member in your family who has been diagnosed with male breast cancer, you should also consider to be genetically tested. If there's any family member or yourself have been diagnosed with ovarian cancer in the past, you should consider to be genetically tested. Or if there's a family history of breast cancer combined with other malignancies, and this is the list that you can see, I'm not going to go through all of those, you should also seek genetic counseling and consider genetic testing. If you really want to know what your risk is going to be of developing breast cancer over your lifetime, there's different models. These are mathematical models that have been created. I'm not going to go through each one of them in detail, but you can talk to your physician about them. And these are especially designed to have an idea of what your risk will be over your lifetime. Now, things have changed. Things have improved. That's why we see less patients die of the disease. And part of it is simply because we have become much better when it comes to our technology, our mammography, ultrasound, the use of MRI, meaning that we're being able to detect cancers at a much earlier stage, and therefore that leads to better survival. So just to remind you, on the current guidelines, women with a normal risk should have a mammogram every year starting at age 40. So if you do have a high risk of developing breast cancer, there are things that you can do to lower that risk. So for example, perhaps the most radical of all is to undergo prophylactic mastectomies. This will reduce the risk of breast cancer by 90%. However, you do need to keep in mind that there's still the possibility of you developing a breast cancer, since this is not an 100% effective method. And obviously, there's the issue that comes with having a mastectomy and some of the disfigurement that you can have by just having both breasts removed. Also, removing your ovaries has not only shown to decrease your risk of breast cancer by approximately 60%, but obviously it will decrease your risk of developing ovarian cancer if you are at risk of developing ovarian cancer as well. This is mostly recommended for those patients who are known to be genetic carriers of the BRCA1 or BRCA2 mutation, or perhaps any other mutation that has been found. There are other options that are not so radical. These are medical options. They're drugs that we use. This is what we call chemo prevention. So we have 2 drugs, tamoxifen and raloxifene. Tamoxifen was the first drug that was actually approved for treatment of early-stage breast cancer patients, but also for treatment of advanced breast cancer patients, and eventually was the first drug to be approved for those patients who don't have a diagnosis of breast cancer, but who are at risk of developing breast cancer over time. Raloxifene is a drug that is not as widely used, but also has been approved for the use of patients who are at risk of developing breast cancer over time. Obviously, all of these drugs do come with some toxicity and side effects. You may have heard also about the group of drugs also known as aromatase inhibitors, letrozole, exemestane, and anastrozole. These are medications that have also been approved for the treatment of early stage and advanced stage breast cancer, but they also are approved for treatment of patients who are at risk of developing breast cancer over time. And again, these are medications you can talk to your physician about them and whether you are really a candidate for any of them. At the end, like I mentioned earlier at the beginning of the talk, a lot of our cancers are developed, not only breast cancer, but they're developed by our environment, our lifestyle, things that we do. And so the best prevention is always lifestyle modification, exercise, maintain a normal weight, avoid smoking and alcohol. If you don't need to have a hormone replacement therapy, I would avoid those as well. And that eventually will decrease your risk of developing breast cancer. So as a summary, breast cancer is still very common. It's about 1 in 8 US women that will develop it. There are many factors that contribute to the development of breast cancer. So it is a multifactorial disease. Some of those factors you can control, some of them you cannot. There's different things that we can do to assess and evaluate what your risk will be over time. And there's different strategies, like I mentioned earlier, that you can use also to eventually decrease your risk of developing breast cancer. Screening is vital. So women over 40 should always have a mammogram on an annual basis. And at the end, you should definitely talk to your physician about your risk for breast cancer and what would be the best strategy. Thank you.